there's going to be a little brief intro about direct primary care, because I know most of you all know about direct primary care, but just to kind of talk about what it is, because it is different. And so it is interesting talking about this brain check program also, because it's a little bit high tech as far as what it's doing. And direct primary care is more low tech. It's kind of one of the ideas behind what we like about direct primary care and what I think makes it really good. So direct primary care is similar to concierge medicine, and people have heard that term before, except I don't like the kind of connotation of the term concierge medicine, because it kind of gives us a little highfalutin idea of someone paying thousands of dollars a month and the doctor doing whatever you want them to do. So that's not what direct primary care is. But the same idea, where direct primary care is a monthly membership, and then everything that we do in the practice is included in that monthly membership. And then our practice is called Rooted Family Health, or Rooted Family Direct Primary Care. And we have these tenets of what we want our practice to be about. And so one of it is rooted in every person's dignity, and so that we treat people like people. You know, we believe that people were made in the image of God, and so we should treat them as such, and not as a number, not as, you know, other things that how people feel like they're being treated. And then the second part is getting back to the root of medicine. You can see where where our name Rooted came from. Getting back to the root of medicine, the doctor-patient relationship. And so the idea behind that is, I feel people in direct primary care and myself feel like one of the big faults of our healthcare system now is because we've kind of handed over a lot of the care to bureaucracy, companies, insurance companies, and things like that have a big say in how physicians treat patients now. Things we can and can't do, and who's going to pay for what. And so we're trying to get back to that doctor-patient relationship being primary and being the key. And then taking time to get to the root of the problem to help patients find help. And so that time is a big thing, a big problem in doctors' lives, a big complaint in patients as far as the amount of time that they have with their doctor, time is just a big part of the problem in healthcare right now. So, and one of the big things with direct primary care is really being able to spend time with patients and give them that time that they deserve and that they need to really get the good care that they need. So those are what we're about. So our team, sorry, I'm playing with these. Yes, so you'll see some of these different ones here. So there's myself, Dr. Chris Imperial, Becky Imperial. Becky is my wife, and she's a nurse. She was an ICU nurse by training, and then she stopped working once we started having a bunch of kids. But she's still a nurse, and basically our office manager, does everything. One day she was running back and forth to the store to get things. Dr. Amy Harrell is our newest addition. She's a gynecologist. She left Scott and White after 20 years, and so she's here part-time. She's here 1 full day and 2 half days. And so we love having her here, and it's been a real help. And she does she's learning how to do more primary care too since she's been here. Nancy Cifuentes is a nurse. She's our LVN. Most of you guys have met her also. So she's another kind of do-it-all. She was my nurse over at my other practice at St. Joe's for several years. And she could do just about anything. She's drawing blood, which people appreciate, so you don't have to run to the lab. We can draw your blood here. And then Noah Imperial, I just have to introduce him, our son. He's usually homeschooling in the back, but usually you either see or hear him during the day, so he makes himself known. So our goals, the goals of our practice, and often of many direct primary cares, are to simplify the delivery of healthcare and to improve access. So we feel like those are two of the big problems that I was experiencing over at my other practice too. I still believe that we have the best healthcare system in the world, but it's the way we deliver it, the way we get healthcare from everyone who has the services down to the patients is what's broken. And it's difficult and confusing, and no one knows how insurances work. One way you can tell that direct primary care is something that is probably here to stay and probably going to keep growing is when other big corporations start doing it. So you may have heard of Amazon. Amazon has just purchased a huge primary care practice, and they have started doing basically the same thing, direct primary care. I think it's called One Medical. So if you're an Amazon Prime member, you can pay $9 a month and get primary care from Amazon. And they're hiring all these doctors to kind of be on staff with Amazon to do a similar type thing.
So do you do it face to face or
you
have to do it online?
It's mostly online. You do have to pay more to do a face-to-face visit with them, but you'll get a virtual visit whenever you need to. They have a pharmacy, obviously. Amazon will have a pharmacy that they can get all your prescriptions and everything like that. So when Amazon starts doing something like this, you know that there's something that people are liking about it. So if anyone has any questions, just interrupt. So
won't it get out of hand with Amazon? I mean, can't you get those things from, like, my insurance lets me call a doctor,
right.
You know, if it's in the middle of the night or something, I need help, but, so, it just seems like something they needed to not take care of.
Yeah, I don't know. It'll be interesting. I mean, I don't think that's what people really want. I mean, I think it's an idea. You know, they're just trying to solve problems. Basically, is what they're doing. But I don't think that's what people want. I don't think when you're looking for a doctor, you want to just get on the phone and look at a picture of someone who's different every time you call in. So.
Well, I mean, don't you need to look at us sometimes to see what's wrong?
Yeah. I mean, I think so. I mean, that's what I think too.
I mean, we basically had that I'm an Air Force wife. So you know, it was kind of a bet as to who would deliver my baby.
Mm-hmm.
Would it be ABC or the doctor, you know? So, yeah.
All right. And then so we believe direct care, and you'll probably hear more. What we're doing is called direct primary care. There's the beginnings of some direct specialty care where there's some specialists that are starting to look into ways to do this better access and more simple care, so you're not so dependent on insurance companies. So, you know, with transparent, reasonably priced monthly fees, you know, the patient has access to care and the physician can do the kind of medicine that they want. Now, one thing that is confusing that I'll talk about is it's not that we don't want people to have insurance. You know, the majority of my patients have insurance. And we want you to have some degree of insurance because I can't take your gallbladder out. I can't, you know, do brain surgery or different things like that, or do a CAT scan. So if you're going to need some of those things, which we know that people need those things, you want something that's going to help you in those situations. So we want people to have catastrophic insurance that covers for those high-costing, catastrophic type situations. To pay for those. But a way that I think about it or try to explain it, it's kind of like our auto insurance. You know, we all have auto insurance, but we don't use our auto insurance to put gas in our car or to get it fixed for something or oil changes or different things like that. Those primary care type things for our car we do on our own. And so that's what we're going to try to do. We're going to try to do all those primary care things for your primary needs that we can take care of, you know, in these four walls here, will be included in that. A good example, an example that I always like, early on when I first started, we first got into this building, I had a patient of mine who was a patient of mine at the other practice for years, and I took care of his family, and he's a painter, takes care of his own bills. I don't think he had insurance. So he joined, and he called me one morning at about 7:45 and said while he was cooking breakfast, he dropped his knife, his cooking knife, on his toe, and his toe was bleeding. And I said, okay, well, I'm just about ready, let me meet you at the office. So we met him, I met him here at the office, looked at his toe, cleaned it out, sewed up his toe, and he was back out by 8:30 or so, and was able to still work that day with his sewed up toe. So
How long would it have taken?
exactly.
If we were calling St. Joe's.
Yeah, calling the office or even urgent care.
Yeah.
You know, so
Oh, yeah.
oftentimes, I mean, I can't be everyone's urgent care all the time, but again, one of my goals is to limit my patients from needing urgent care centers. Because the purpose for urgent care centers, I mean, many of us remember before urgent care centers were even around. You know, so the reason why they came about was because we couldn't see you. And because our schedules were filled with other patients, and if you called that day, we were booked, and it was something that couldn't wait till the next day or, you know, 5 days down the road, and so out pops these urgent care centers to take care of those. And they still have their need. I mean, I think their urgent care centers do a lot, but I think they do more than they should. You know, and when people start using urgent care centers for their primary care needs, that's when it's not good at all.
Do you want a really up-to-date example of this?
Oh, sure.
Okay, so my son woke up this morning and had a sore throat, and he never is sick, and he said, my throat is really sore and I'm achy. And I was like, okay, that sounds like the flu or strep. So call the doctor's office, and this is a doctor we've been seeing for years. He's on vacation. The other 3 doctors in his practice have no availability today. So my only other option is to go to urgent care just to get a strep test.
Yeah.
I know he needs a strep test, possibly a flu test, but I don't know which. And he doesn't even really need to see a doctor, to be honest. Thankfully, as you know, my brother-in-law is a doctor, and he's not our family's doctor for good reason. We don't want to always call on him. But in this case, we were desperate, and so we texted my brother-in-law Matt and said, hey, what do? We can't get into our normal doctor. Is there anything you can do to help? And he said, I'll put it in order for a strep test, bring him up here, get him tested. So we did. We waited probably 20 minutes to get a strep test, and about an hour and a half later, Matt texted and said, he's got strep. And I've called in his prescription, go get it. And so he's already had 2 doses of antibiotics at this point.
Yeah.
Which I don't know where we would be if we didn't have Matt.
I know.
So, yeah.
So having practiced in that kind of traditional insurance-based practice for 22 years, there's a reason why that is, why you can't get in to see your doctor that long. And it's because of insurance. So what ends up happening is, well, there's several different reasons, but all of their schedule, their slots get booked because anytime someone calls for something, they have to schedule an appointment. Because the only way the practice makes money, the only way the doctor makes money is for office visits to be booked. If there's no office visit, then there's no cash flow coming in. And so then, you know, if you say, I need to talk to Dr. Imperial about my medicine, the first question is, well, when can you come in? You know, it can't be, well, let me get him, he can talk to you at this time or something like that. And so they need an office visit for that to happen. I mean, I did that for 20 years. And
So now I just text you.
so now you can text me and I can give you an
And you
answer.
send it right away.
And you don't always need an appointment. So a strep test doesn't, I mean, probably would have been good for someone to look and, you know, take his temperature and make sure, but if it's a young, healthy kid with typical symptoms, you know, for something like that, we could just have him come in and Nancy swab his throat. Nancy usually knows more than I do anyway, so. But yeah, that's a good example. So the services that we do, I know most of you guys already know this already, office visits with Dr. Harrell, full service gynecology. She does ultrasounds and colposcopy, all the phone, text, email that you want, in-office testing, strep test, food test, COVID test, EKGs, ultrasounds, diabetes and lipid testing, injections, joint injections. We do antibiotics, steroid injections. And then coming to what a lot of you guys want to talk about, brain check. So again, when it's interesting when I go to these direct primary care conferences, all of these doctors who are wanting to go back to kind of old school, old traditional type medicine, they're all into technology. They all want to try to have the best technology out there. And so that's where I learned about this brain check technology. It's similar, if any of you have ever been to the doctor's office and they said, we're gonna do a little test of your memory, and they ask you to remember 3 words, they ask you to spell the word world backwards, they ask you to count backwards by 7s from 100, all these different things like that. This is similar to that. When I did that for the past 20 years, it was more just to get a check mark and say, okay, I tested their memory. But actually testing it and scoring it takes a lot of time to do that. And so this brain check, it's a tool to detect and monitor cognitive decline related to lots of different things, to age, medical conditions, medicines, anything that we do that can kind of cause our memory to decline. Most people think about age, you know, are we getting dementia? Are we gonna have Alzheimer's? But other things, you know, past illnesses can affect it. Medicines that we take, people who are on chronic pain medicines or anxiety medicines sometimes can affect our memory. ADHD can affect our memory, different things like that too. So the thing I like about it is we can do it for people, anyone, we can get a baseline, and then we can do it serially. We can do another one in 6 months to a year. It gives a number score, and then so we can compare that over time and kind of see how people's memory are doing, you know, how their memory is doing. The other thing, I was reading some articles about it, and they used it to determine whether someone was intoxicated or not. They did this study on people who were intoxicated and people who weren't. They did their blood alcohol levels and they did a test on them, and they could see that the people who were intoxicated had scored lower than the people who were not.
That makes sense. Spell world backwards. Been drinking, that's a wonder.
Exactly. So the other thing, it can be done in the office or it can be done remotely. So I can send it, I can email it to people. The hard thing is that I always feel like the first one should be done with one of us helping you, because sometimes the instructions can be a little tricky and maybe so. But I've sent it to some people remotely and they did fine. So some people, that makes it easier for people. They can do it on their own at home. Oops. So let's see if this will work. We're gonna give you a little video. Maybe.
It worked earlier when we tried it.
Testing our technology now.
That's how our brain works. It's gone around.
Something's
Something
gone
went wrong.
Yeah.
I know, that's so weird, it just worked.
Mm-hmm.
Let me do this, let me close out of that.
I like the idea of doing one and then 6 months later, and I would like to, because I think it's age, that, you know, how do you know? It's just age.
Sorry.
Is your Wi-Fi down?
You know, it's not. Yeah, it's the,
It's the link there.
let me see if I can. It's trying. This looks
You could
better.
why don't you just show it on there and just hold your computer up.
No, it's not disconnecting.
Who developed this? Who's behind it?
It is a group, I think the main neuropsychologist is out of University of Massachusetts. They developed it back in 2019 was when it first started coming out. And they're using it, at least according to the website, they're using it in, I think, Stanford, one of the hospital systems in Houston. I don't know how widely they're using it right now, but are you showing this right now? If you guys can see this.
Cognitive impairment is extremely common and all too often goes undiagnosed. An estimated 11% of adults over the age of 45 have subjective cognitive symptoms, meaning they perceive changes in their ability to think and remember. These concerns should be investigated seriously. Alzheimer's and other dementias are the top cause of disabilities in later life. Fortunately, recent studies show early detection and intervention could prevent or slow up to 40% of dementia cases and reduce the costs by up to 25%. That's why primary care physicians need a way to quickly assess, confidently diagnose, and easily plan care for patients' cognitive health and get compensated for it. They need BrainCheck. BrainCheck's rapid, reliable cognitive health technology is designed for everyday clinical use. It gives clinicians meaningful data to assess, analyze, and act on their patients' cognitive concerns earlier and more effectively than ever. Here's how it works. When a patient or caregiver expresses a concern about memory loss or cloudy thinking, or if their doctor has a concern, a technician can administer a BrainCheck assessment in clinic, or it can be completed by the patient securely at home. Our standard battery consists of 5 gold standard assessments, and it takes about 15 minutes. Once complete, clinicians can immediately access our detailed clinical report, which includes an overall score and individual scores for each cognitive domain, as well as clinical decision support to help doctors diagnose with confidence and track cognitive changes over time. If there is a cognitive concern, BrainCheck's Cortex platform includes tools to streamline creation of a personalized cognitive care plan, which can include additional follow-up or referral to a specialist. With BrainCheck, clinicians can increase access to cognitive care, improve the quality of care, and get properly compensated. Want to know more? Schedule a demo with a member of our team.
So, and then I won't do an actual, let me see if this will, an actual test. But I'll show you, this is on their website. So this is their cognitive battery. So there's memory, immediate and delayed recognition that tests your ability to recognize items. Basically, it just kind of throws up 10 words at the beginning, and then they'll ask you yes or no whether that word was one of those 10 words or not. And then this Trails A and Trails B basically are kind of testing your attention and how well you can kind of stay on task with different things. And you know, it's a good, I never thought to look kind of the educational baseline behind it, but it's pretty simple. So for this, you do have to know how to count because you're going from numbers 1 through wherever it goes, and then you have to know the alphabet in order also. But besides that, there's no other educational amount. You do have to read, obviously, because the words are showing up. And then executive function, there's 2 different tests that they do. One is just recognizing words and pointing to the right word. This one is probably the more complicated of them, where you recognize a symbol and associate it with a number that's with it, and then push that correct number there. So those are the main battery of tests that you have to do. So it's nothing that's really, I think spelling world backwards is harder than that. But there is a little bit of coordination because you have to move your fingers around like that. And then speed is part of it. How quickly and accurately is a big part of the testing there too. So, any questions about the testing?
So we can do that testing at home?
You can. Mm-hmm.
Well, I mean, I was gonna ask, is there a problem, like, say we're in here and so you leave and somebody said, well, what kind of glasses was the doctor wearing? And we go, well, pay attention, you know? Is that a problem? Or is that just, I didn't pay attention? Or what kind of plan do you have behind you or something? Somebody asks you, did you notice the plan? You know, whatever.
Yeah,
Is
so
that a
with,
problem, or
memory.
or should we know everything? when we
No.
go?
So with memory issues,
Please
what,
say no.
what we're
No
really kind of dealing with is a problem. So if there's not a problem, and it's not just a problem with you, because a lot of times with patients with dementia, they don't have a problem not knowing what's going on or remember or getting lost or anything like that. But there has to be a problem. So either the problem with yourself, you know, danger to yourself or getting lost or, you know, forgetting things, or a
That's
problem.
what the big problem is.
Or a problem with the other people around you too, like because of your memory loss, you're you know, having a hard time dealing with your family or things like
It's not
that.
just losing your keys or something in your house and you're trying to find them.
No.
It's something more
Right.
difficult than that. Yeah.
Typically it is. So losing your keys sometimes can be a early sign, but you know, there's some people that have been losing keys since they started driving.
I was gonna say, my sister-in-law has a tag on her. So she can-
Yeah, exactly. So again, there has to be a problem that we're trying to
Okay.
kind of solve or tease through and figure out.
'Cause I just wonder, I mean, because sometimes, you know, my wife will say, do you remember what kind of glasses you were driving? You know, I look at you in the eyes or something, and I don't.
Maybe she's just testing you.
Maybe. So I just, you know, I just thought, it got started something, because I'm going, well, I didn't notice that, I mean, should I have noticed that? And
Or we're so used to looking at Dr. Imperial that
I guess.
that's the way he
Well,
looks.
sometimes people are more observant than others.
Yeah.
And
Yeah,
I think
I
that's
guess they
just,
are.
I think that's just the way it is.
I mean, if I was observing about your television or something else, I might remember that.
Yeah, exactly.
It's important to me to,
Right.
Yeah.
that'd be important to me, you know?
Mhm.
Right.
Well, I think sometimes too, back when my husband and I were in our late sixties, late sixties, I think, we were called by an insurance company. We were trying to get long-term, home health care. And so they gave you this test over the phone.
Where you can write things down and
Well,
cheat.
no, not like that, but it was the questions, because they told us to each go in the room by ourselves to answer on the phone. So we're answering verbally on the phone, the questions. But what was so interesting, because my husband and I had both about the same college type degree, except he was a math person and a commander in the Air Force and those kind of things. I was a kindergarten teacher.
Yeah.
So the difference was, I really scored well on all of those verbals, because the questions were things, kindergarten teachers are very general. So the questions were very like, name 5 fruits.
Yeah.
Name 4 wild animals,
Yeah.
and all these, just all
Different.
kinds of different things. Whereas they didn't ask him any math questions
Right.
or how to deal with the leadership of the country or anything like that. And so he was aggravated at the end of the two, because I appeared to come out really ahead of him.
That is
It was
so
kind of
funny.
comical in a way, but I didn't think it was a very fair
Yeah.
way of testing two different people that
Mhm.
probably our brain power was close, maybe, I don't know,
But
but our
different.
fields were totally different.
Right.
So
And that's
anyway, I
probably
just
what
thought I
they're
would bring
trying
that
to-
up on this testing thing. It's
Yeah.
kind of interesting.
Mhm.
They're probably trying to,
Well, I do appreciate, because they
Yeah.
show you words.
yes.
So
But yes.
they actually show you the words, so they don't say, guess what words on this page we're gonna test you over. Like, you know, guess that did you look at any of the paintings in our whole building? Like, no, they show you all the words, and then at the end, you go over it. Was this word on it? Was this word on it? Was this word on it? And you say,
You're
"That's
studying
right."
it.
Yeah, that's
You know, like
fair.
even with, glasses, eyes, my daughter-in-law that's, you know, in her 30s, if we walk away from somebody, she's, oh, they have the most beautiful blue eyes, blah, blah, blah. I'm like, They had blue eyes. I never even noticed the color of it. It's just not something I noticed, but she's very focused on that.
That is so
But and what about short-term memory? Like, that's what.
So that is, so again, with that battery of testing, so with this test here where they throw up the 10 words, so they're gonna ask you right away, was this word on the number of these 10 words? And then they ask you again at the end.
Yes.
And that was the same way whenever we did the test before, I would ask you those 3 words and ask you to repeat them.
Yeah.
And then at the end of doing all these other crazy things, ask you again to repeat them. And so there's always that kind of short term and longer term. It's not really long term. but
My short
delay.
term is like, the other day when we came in, I came in with Madeline, and I had told your wife we'd see her Thursday.
No.
Well, when we went out to the car, she yelled back, she said, "See you Thursday," and I asked Madeline, I said, "Do you have a doctor's appointment Thursday?" "No, you're coming Thursday."
Oh, yeah. Can we book our test tonight?
Carrie said, "That is one meeting we're going to."
Because I do that all the, it's just, and sometimes really I think she can answer her own question after.
A second.
Yes, like it kind of comes out before it
But
processes.
that's it, I mean, that never entered my mind, she was saying, "I'll see you Thursday,"
Yeah,
you
she
know.
forgot all about it already.
I'd already forgot about
Yeah,
it.
so sometimes after we do a test like this, depending on the score, if there's something that we need to do further evaluation for, we can do that too. Anxiety is a real common cause for memory issues, or kind of the big thing that people complain about are word finding problems. Like they used to be able to speak real well, and it's like, oh, that word, I just can't.
Now I have to describe it to somebody to guess what it is.
So, but the more you try, the more you strive to try to find that word, the harder, the more lost it gets. But then usually once you walk away and you stop trying, it just pops into your head. And so that anxiousness inside of our brain causes problems with what we think could be recall or memory. And so sometimes what we do is it's not a test for anxiety, but it's a questionnaire that we can send that will ask about anxiety or depression or attention issues, so sometimes there's some follow-up things that we can do also.
Is it kind of like you're watching a game show on TV and you know the answers, but they're taking a little bit harder because they have the stress. The 10,000
Yeah. Oh, yeah.
Get from it.
Yeah,
So
exactly.
I think that has
I
a
can
lot
guess
to do
it
with
is.
that,
You know?
Exactly.
So I guess it's the same thing.
It
it's
is,
stress.
yeah. And that's what makes, that's how come I think the game shows do well, maybe not the contestants so well, because they know that people are gonna be stressed out trying to do it and things like that, so.
And it's the time crunch too, they have to do it.
Oh, yeah,
You just don't have all the time in the world to think about it.
Right.
But if you already have anxiety or depression, so that can cause memory problems and.
It could show up as kind of, again, recall, maybe not, I wouldn't say necessarily memory problems, but maybe recall problems or test taking problems.
Yeah.
Well, could it be also like if you're tired or?
Oh, yeah. Again, alcohol.
Alcohol, yeah. Sure.
So, and I think that's kind of the power of the serial testing too, where you can do it again in 6 months to a year, and then over time, I mean, in reality, when I was talking to the people about this, they have some pain management doctors that will do this every month whenever they are giving refills to their pain patients, and then they can kind of monitor it over time. So there's no limit. So when they talk about reimbursement, that's for people again who charge insurance. Doctors can bill their patients' insurance to do these tests. So that's when they're talking about making money. But
So what's your plan on how to use it in your practice? Or are you just trying to figure that out?
well, still trying to figure all that out. I mean, definitely for people who are concerned about their memory, instead of me doing a clock drawing and mini mental status exam, all these other tests that we used to do before, I think this is going to be a lot better. And so I'll be doing for that memory or cognitive decline, basically. And then probably trying to do it with people who are chronically on different medicines and see how sometimes showing them how it's affecting their brain and their memory, they'll say, well, maybe I shouldn't be taking that medicine so much, or doing different things like that. So it, again, kind of back to the whole direct primary care thing, it kind of is the beauty of it. I can use it however I want.
Right.
So I do pay for the subscription for it, but I mean,
So it's not really based on how many patients you test with
no,
it?
no, I can do,
Yeah,
I can do
so you
it.
could do it once a month, you could do it once a year.
Exactly.
Depends on, you could, one patient might want it once a month, one
Yeah.
patient might say, I wanna do it every 5 years.
Right. So it's just a service that I want to provide to
Yeah.
patients, but I think it'll be really good and,
Yeah.
and really helpful for people.
Yeah.
For me too, you know, because the other thing I'm hoping is that it'll keep me from having to refer people out as much, especially because there aren't many neurologists in town and it's impossible to get in to see a neurologist. So if I have a concern about someone's memory, I can kind of start down this process. I can kind of get an idea, get a little further than I could before down kind of the workup, and maybe, you know, come up with an answer, or, you know, then refer maybe a little bit later or something like that.
Are there neurologists that like, does it allow you to communicate with a neurologist?
Not the
neurologist?
program, no.
No, I
There-
mean, like if you had seen, you know, this patient's been tested every 6 months for the last 5 years, here are their scores, does that help the
I
neurologist?
think it would, you know, and I think it depends. As far as these different types of tests that this uses, there might be some neurologists that aren't aware of them, because they're more
That's pretty good.
neuropsychological testing.
Okay.
So the neuropsychologist that will be aware, probably Dr. Powell, who's right next door, he probably is aware of all these different kinds of tests.
Right.
But there probably are some neurologists that won't be aware of that type of testing, but the neuropsychologist would. So
To do that, you just call and make an appointment to come in and do it.
you can call and make an appointment. Yeah, you can just let us know if you want to come in and do it, and one of us would sit down with you and do that test.
Dr. Imperial, how much is processed food affecting the brains, you know, of seniors as well as children now?
You know, I don't know. I mean, how to quantify how much it does, but it definitely does. I mean, I think, you know, in everything that you're reading now about inflammation and things like that, I think the majority of that inflammation comes from what we're putting in our body. You know, and a lot of the processed foods a lot of the foods that we eat, you know, that have a lot of preservatives, but then also a lot of plastic. A lot of these fillers that we put that go into our food are kind of plastic products, and our body doesn't know what to do with it. So it tries to attack it, and so that's gonna cause all sorts of different problems in our body. Is there a solution to that right away? I mean, unless you wanna eat just what you grow out of your ground, that would be a solution, but a lot of people can't do that.
And one more question, do supplements help, you know, seniors and all as they're getting older, you know, to help with?
Yeah, you know, it's hard. Supplements are hard to determine how much they help also, because no one does those studies. But you know, different things like ginkgo biloba have maybe shown to have some benefit. Again, sometimes it depends on what the problem is that's affecting your memory. I have people that ask me almost every day about Prevagen, and I don't know. I don't know about Prevagen. I mean, they say lots of things. Good to meet you. No, you guys have a great time.
Enjoy your time.
You know, they have done studies on like turmeric and
Oh, yeah.
shown that it does help decrease inflammation.
Yeah, I
Talked
take
about
it.
that
I don't know
earlier.
how many years I've taken it.
But, you know, it's interesting, we had Dr. Mead come, and she's a weight loss doctor, and she talked about supplements. She doesn't really like supplements. She would like for you to get the vitamin in the food. She said, we don't know if the vitamin itself is what's beneficial to you, or if it's the vitamin in conjunction with the food that it's in that is beneficial to you. And she feels like it would be better for you to get the vitamin in the food itself than use supplements. So I just appreciated that insight. I think you have said that over the years.
Well, I mean, again, what I tell people is the word supplement. You know, we oftentimes don't think about words because we use them so often, but they were called supplements because they're to supplement our diet. So, you know, someone who can't drink milk or someone who hates carrots or things like that, those vitamins and minerals that they're missing out on, they feel like they need to supplement that with something. So they take this pill to kind of make up for what they're not getting in their food. But again, as we all know, the human body was designed to use food, and so I think food is always the best.
And you don't, the FDA doesn't even, they don't do stuff like they, I mean, they don't test them.
They don't, yeah.
See,
Well,
that's
they
the
just
problem.
have to. They just have to.
They have to
say that
have
they're
the
safe.
amount
Right.
that is in there.
They right. They test to see if it's the amount of that vitamin that they're
Mhm.
claiming it to be, and then safety. Obviously, the FDA has to approve it for safety.
Will they do that for the supplements?
I think for anything that they
Good.
advertise as being taken by mouth, they have to approve it.
Okay.
Yeah. But I don't know.
I've never had much luck with any kind of supplement. Like when I was going through hot flashes and stuff, so many things were recommended and nothing seemed to help me. So it's just, I guess, the way your body reacts to
Yeah.
it.
Have you given these tests, have you started giving them?
I have, yes, that's a good question. I mean, including myself, my wife, and my nurse, and I think we've done about 20, almost 25 of
Yeah.
them. And so I'm learning, you know, because you learn as you do them more too, and administer them and kind of review them, so. And it can be something, sometimes if I have a patient in for a visit and we're talking about it, something comes up, I'll just send them out and they'll do the test out here. So,
It doesn't have to necessarily be a separate appointment.
right. And again, it doesn't take very long.
No.
Does Medicare ask for something like this?
So
I remember
Medicare,
you doing something
yes.
with me.
So every year, Medicare, those Medicare wellness visits.
Okay.
So Medicare doesn't require a wellness visit.
They don't,
They don't require that. But they do like it. I think it's good. You know, for years, Medicare didn't pay for anything preventative. They only paid for sick things. And then so maybe 5 or 7 years ago, they started reimbursing doctors for preventative care, and so they started these wellness visits. So it does help the doctor because the doctors would get reimbursed better for a wellness visit, but it's because it's supposed to take more time to do those. And then the memory was always a big part of those medical visits.
So is this part of our membership if we take?
It is, yep.
Mhm.
Mhm, it sure is.
Victoria's mother-in-law and her dad had an appointment with the doctor, but I think her dad came in the morning and she went in the afternoon. So he went in the morning and then he called Julie and he said, "Oh, the doctor's going to give you these questions." so these are the 3 words.
Cheating.
That is so
Yeah.
funny.
That is hilarious.
Typically-
Oh my God.
Her 85-year-old dad called her. She's like, she's not 60 yet. He said, "These are the 3 words that they asked me on the
That is so
test."
funny.
And they gave her the same words.
Yeah, because I always gave the same
Yes,
3
yes.
words, because otherwise I wouldn't remember.
Would you?
No. I either would write them down, if I were the 3 words I picked, or I would use
Yeah.
the same.
Well, I like this because I had a friend that her husband was having some problems and they told the doctor, and the doctor was like, "Well, it's age, what can I do about it?" And so they were kind of dismissed. And I said, I don't think that's right. If he has some real concerns, or the wife has some real concerns, there should be a way
Yeah.
that they could kind of gauge it. And so I'm going to tell her about this.
Yeah, I've had a couple of people they had concerns about their memory, and we did the test, and they actually scored really well. So it encouraged them
You
that,
can feel better.
yeah, that it's not really their memory per se,
Yeah.
but they, something else, maybe the anxiousness or
Yeah.
stress or things like that are making it
I
hard.
think they had some things going on in their family that certainly could have, but I didn't think that it was right, the doctor just said
Right.
it's age, cause he's in his 70s, so.
I think listening and attention are big barriers. And you may well, I may ask, did you remember what I told you? No, I wasn't listening.
Definitely. And my wife used to say to our
Sometimes we think it's they're not remembering, but it's really that they're not paying
Right.
attention.
Becky would often say to people, say to our kids, look at me in my eyes. When she's trying to tell them something that she wants them to remember.
So you can test for attention deficit or?
So it will, so that one test will, this one here will kind of give attention to your attention, how well you can so it measures visual, search speed, scanning, processing speed, mental flexibility, and executive functioning. So I know that's the other thing. There are a lot of scientists, neuroscientists, that went into a lot of research into figuring out, what the problem in our brain is and how they can test for it. And so I'm kind of excited about using these tests to get more ideas of what's going on.
Well, the doctor told me once I had attention deficit, and I don't think I have attention deficit, I just like to do a lot of things at one time, and I can do it.
Mm-hmm.
But I think that comes from teaching,
Yeah.
from having to be
Yes.
putting out
multitasking.
fires all
Yes.
the time, and being ahead of what a 4-year-old was
Yeah.
gonna do with this thing I was giving them. But, so be nice.
Yeah, so what I do tell people about ADHD, attention deficit, is actually multitasking is kind of a form of attention ADHD.
Okay.
So usually people who have ADHD are multitaskers. I'm not a multitasker, and I don't have ADHD. But again, the problem, so ADHD by itself isn't a problem until it's a problem. And so when I'm seeing someone with possible ADHD, I'm not treating their ADHD, I'm trying to treat the dysfunction that it's causing. Because there's some people that are multitaskers and they're doing this and they're doing this and nothing gets done.
Oh, okay.
Yeah.
See, I never saw a problem with it.
Right.
It's true.
Until he made it a problem.
I don't think I have the H, I just think I have the AD.
So
I
if you
mean,
get
and I
this
taught,
done, you're
but
okay.
I think,
Is that right?
I'm the one that's
What'd
gonna
you
go
say?
to the back of the
As long as you get it
magazine and
done,
I'll
it's
get the
okay.
front.
As long as you get
I'll
it
just
done.
be like,
It's not a problem.
'Cause I like
the
to do that
place,
stuff.
and
Yeah.
that there's no hyper business in it.
Right.
Yeah, no, mine's not like
Well, it's kind of like if you were doing laundry, for
But it's just
example,
all over the
and
map.
you do laundry, and then you walk away till it's done, and then you put it in the dryer. But you don't sit there and watch the done.
Exactly.
You gotta do something
You do
else.
something else.
So I can do two things, right?
Yeah.
But if it doesn't get done, but a lot of times you get a problem. And my dad always said, well, if you have a problem and you're having a hard time with it, do something else for a while and come back to it and you get it done. And it works.
Right.
You know, you little
Just
time.
clear your brain.
As long as you get it done. right?
As long as you go back to it. So the problem is
Yeah.
when you never get back to those things,
If I just
and you're surrounded by all these unfinished tasks. And so that's when the ADHD is a problem. Same thing with kids in school. Sometimes, as you know, they have all these different things going on, and they just can't stay on this one task to kind of complete it from point A to point B to point C. And so it can be a problem.
You can definitely tell when you're teaching those children if they're just hyperactive or if they're ADHD. They can be swinging from the chandeliers and getting it.
Exactly.
Or they can be swinging from the chandeliers and not getting it. Thank God he's getting it.
Or they could be sitting
He's I'm
quiet.
not climbing on the wall. Like, okay, now come on down and teach the rest.
Or they could be sitting quietly in the room and not getting it.
Yes,
Yeah,
and not
that's
paying
the-
attention, yes,
Yeah.
yes.
That's the
the
hard one.
ADD part, right?
Do you ever give anybody the test and then when they come back in for the results and you go, how did you know how to come back to get here, you know?
Your results were so bad.
I'm wondering.
Not getting there, huh?
Yeah, I guess I haven't done them enough yet.
Maybe I'll be in next week. But she knows where to find you.
I know we scored bad if you say, now remember where we are.
Yeah. I'll give you a band.
Everybody told me that.
But like, let's say we take the test and then 6 months, we take it again and a year, but are they the same questions where you'll do better next time because maybe you remembered?
So obviously the tasks are the same. So there'll be different words. So you still have, but you still have to remember the words. They'll be the same numbers, but they'll not be in the same place. You know, so it's the same task that you have to do every time. So can you practice and get better? I'm sure you could over time, but
You may do a little better just because of the familiarity.
exactly.
Yeah. But you shouldn't do.
But that's kind of
If
good.
you have a
you
problem, you
remember.
won't do.
Right.
If there's a problem, then those simple things are not gonna be right.
Right,
Tying
right.
a shoe is not gonna be right for you, and that's a simple,
Yeah.
well,
Yeah, the thing about it is, if you remember, you probably don't have that big of a mental problem.
Right. If you remember 6 to 12 months
Yeah.
later, how to do it, yeah.
hey, this looks familiar, yay!
We can just stop the test.
I remember this from last 6 months.
Well, I wanna thank you for having these, they're so interesting, and I feel bad when I can't come, but you know, there's just sometimes you can't make it. So
It's
this
okay.
will help.
Yeah.
Or
Yeah.
I could look at it again, or show it to a friend, or